Good afternoon, and thank you so much to all of you for joining us online this afternoon. We're looking forward to a wonderful conversation with our experts this afternoon. You know, it's been about a year, more than a year, since the coronavirus hit the U.S. And I don't know about you, but it feels like much longer to me. It's been a tough year for all of us, whether you were sick, you know someone who was sick, or maybe job loss, or just the stress of everything that's been going on. And now after all this time, we're still wearing masks and social distancing, but there is some hope, right? So we have multiple vaccines available, a lot of people rushing to get vaccinated so they can be with their family and friends and enjoy activities again. But for some folks, there's still some hesitance, right? You maybe aren't quite sure if they want to get the shot. Maybe that's you. Maybe you still have some lingering questions before you decide. So we're here this afternoon to help you get some answers. And if you're watching and you have questions, please post your questions in the comments below. And our wonderful experts this afternoon will help you get some answers. So we're joined today by two very well-respected local experts here from our own community at the Cuyahoga County Board of Health. Let me introduce them quickly. Dr. Sherrie Dixon Williams is former president of the medical staff for Metro Health System. Dr. Williams is a board-certified critical care specialist and an associate professor of medicine at Case Western Reserve University School of Medicine. She chairs Metro Health's Pharmacy and Therapeutics Committee and the Medication Safety Subcommittee. She is a member of the board of Cuyahoga County Board of Health and is the medical director for the Cuyahoga Community College Respiratory Care Program. Welcome, Dr. Williams.
Thank you so much for having me.
And also with us today is Romona Brazile. She currently serves as the Co-Interim Director of Prevention and Wellness Services at the Cuyahoga County Board of Health. She's responsible for oversight of community health and nursing programs, including immunization, among a long list of many other things. Thank you so much. During COVID-19 pandemic, she has served as co-operations lead, responsible for case investigation and vaccination strategy. So thank you for being here with us this afternoon.
Thank you, Deanna.
So you have both been on the front lines throughout this pandemic. Can you tell me, you know, we've heard sort of these numbers, right? And they seem staggering and overwhelming, whether they're, you know, international, national, and local numbers right in our own community. But the numbers can be a little bit, you know, sort of theoretical, right? If you haven't been personally impacted, but these are real people in our communities, in our families, in our neighborhood. Can you tell me a little bit from what you've observed, the real human toll that this pandemic has had, and what you've seen, and why is this different than other viruses that we've seen in our community?
So I definitely think probably Dr. Williams has seen the very forefront of how it's affected people on the health department, and we do get the reports of cases that come in. And I think one of the saddest things that I saw initially, and as we've gone through, is a focus just on numbers, as well as, you know, a debate about are the numbers real or not real? You know, because for me, every person, every case, every number is a person. And in going through our case investigation process, you know, one of the things that's been the most difficult is seeing the wide range of how this has affected people. So when we talk about, you know, it could be mild and they have it for a few days and they feel fine. But then, you know, there's also been times where I've talked to someone who said, when will I start feeling better? You know, it's been so long now. Or, you know, you start to see the families that are devastated, and as it spreads through families. And that's probably the worst for me, is seeing it spread through families and seeing a variety of outcomes in those families where some people are fine, but then others do pass away, and that they can't mourn or come together the way that we would normally do that under different circumstances. So, you know, those are the things that really stick out to me the most. And then also people who have long-term effects, who aren't sure, you know, what is going to be normal for me again, and when will I get there? And so all of those things, you know, as a nurse, that's what actually, you know, that's where I dial in. You know, the numbers are very important because it tells us what's going on in the community. But really, we need to remember that whatever we're talking about people first.
And I would just sort of echo what Romona is saying, in that Many times we think about the individual, right, who is affected with coronavirus, and that person certainly, if they're sick and they're in an ICU setting, like where I practice, that individual um, may pass away. But if the individual is fortunate enough to survive it, one of the things that we know is many of those individuals go on to have long term effects, right? In terms of fatigue and shortness of breath. There are clinics being set up all across America for what they call long haulers or people with post COVID syndrome. And those individuals, when you look at the top diagnoses that they're being seen for psychosocial emotional issues, almost like a post traumatic stress disorder. It's traumatizing because many times these individuals, they were healthy, they were at work, they were doing their usual routines and social activities, and then they got sick and they were in an ICU for 2 weeks, 3 weeks, then rehab, and then home. And so it has a tremendous effect on the individual. But as Romona talked about, it's also a tremendous effect on their families. And I tell you, I have seen complete devastation of families where the person who got sick and unfortunately passed away was the primary caregiver, right? So I have had elderly patients where they're being cared for by their son who is 50 and ends up dying, and now the 80-year-old mother is who's going to take care of me, right? So her life has now been turned upside down, not only from the loss of her son, but the person who was her caregiver. A spouse dies, and the spouse was the breadwinner. So now the family is faced not only with the loss, but the economic devastation and the fear and anxiety of what's going to happen to us. We've lost the breadwinner. I think also one of the things that is really sort of and we don't like to talk about it too much, is really the economic devastation that this pandemic has caused in terms of businesses being closed, in terms of people being sick and having to not go to work or be quarantined, or people being sick and having to recover. So it's had a tremendous economic effect on families, on our society at large. And then I think the other thing that we can't forget is our children, right? Our children are having problems with isolation. Our children are struggling to keep up and not fall behind. We know that single mothers who are home with their kids, it's had an economic impact on them because the kids aren't in school. So in all reality, I think if any of us sit and think about it, we find that really and truly this disease has had a ripple effect and touches every single one of us in some form or fashion. Whether you're a doctor or a nurse or a healthcare worker, or whether you're a support staff worker at a healthcare system, or whether you're a teacher, or whether you're somebody who is just a caregiver of loved ones, it affects you. And so this is why Ramona and I are big proponents of we got to get people vaccinated to prevent this disease.
Thank you. You know, talking about that ripple effect through families, through our community, there is a sense of urgency, right, right now around getting people vaccinated. So, you know, we see, you know, as more vaccines are approved and it's opening up to more people. Can you talk a little bit about why the sense of urgency? Why do people need to get vaccinated? Not just sort of in general, why do they need to get vaccinated now or as soon as they can? Why the urgency for vaccination?
Well, it's, you know, I think a lot of people have heard about the different variant strains of COVID, and we're starting to see that in other parts of the world where it's spreading very rapidly and quickly. And in some European countries, they're starting to go through the lockdowns again, as we had before here. And so, really that's why it's kind of increased the urgency, is because we know that these variants are easier, well, they spread faster. So that would mean that we've done a pretty good job of getting those numbers to start to come down or stabilize, and so these variants really threaten that. I think you don't have to go back that far. I remember in July, being like in the parking lot in tears when our cases started going over 100 cases a day. It felt very overwhelming, and that was just a preview. Because then we got to November and we had days where we had over 1,000 cases a day. So it's really, we can't kind of rest and feel like, oh, okay, well, we've made it out of the woods, or, we're starting to get a good number of people get vaccinated. We can start to let up or slow down. We can't, we have to keep going. And so really, if people have the opportunity, which most of us at this point, probably are either in the groups that can be open, or we're very close to when it's going to be entirely open. So if there's those opportunities to get vaccinated, that's why we're really pushing to get vaccinated now, because we want to keep those numbers low. We want to keep the number of cases that are those variant cases, which we do have some in our county. We want to keep those low. And so we don't see that increase in spread and that rapid spread again.
Mhm. So as Romona was saying, many of these variants are highly contagious, more contagious than the initial sort of wild type that we first saw a year ago. And variants are created or come into existence as the virus is transmitted from person to person. So every time it infects somebody, it learns how to beat the host defense. And so it carries that to the next person and the next person. And so the more people it's able to jump from person to person, the more it learns. Each time it learns, and it gets very skilled at survival, because the whole idea for the virus from its perspective is to survive. And I learn how to survive because each time I infect somebody, I learn something. And so the more people that are transmitted from person to person, the more mutations, and you have a variant that then can become very resistant. And so not only does the vaccine protect people from severe disease, which is what was the study endpoint. So when the vaccines were created and studied, what they were looking for, the primary goal or endpoint was, can we prevent people from dying? Can we prevent severe disease? And the vaccines have done a great job at that. But what we also are now realizing, and studies are confirming this now that many people have been vaccinated, is that it has the capability to also prevent transmission. And so by preventing transmission, you're slowing or retarding the rate of variants being created. And you don't want a lot of variants, because the more and more variants you get, the more and more you're likely to come up with a variant that is resistant. And one of the things that I say to people who oftentimes are reluctant, for good reason, many times good reason, to get vaccinated, is a couple of things. And I wouldn't expect this to be something that people would know or necessarily understand, is that we really do not have great therapy for treating coronavirus. So if you get sick and you're in the ICU, the therapy that we have for you is not stellar therapy. In fact, we don't have great therapy. Most of the care for people with coronavirus is what we call good old-fashioned supportive care. In other words, we support you with the respirator, we support your nutrition, we support you with blood pressure medicine, we support your kidneys if you need dialysis, we give you dialysis. But I don't have an effective therapy that is as effective as the vaccine is at preventing disease. So you hear a lot about antibodies, right? And antibodies do work. They've largely been studied in people with mild or moderate disease, but I can show you many people who have had severe disease who are on respirators and ultimately end up dying, and they have gotten all of the conventional therapy that we use, steroids, remdesivir, antibodies, all the things that people hear, and they still die, right? And there's a lot of those that happens to. And so when you look at the vaccine, it has a 94-95% effectiveness at preventing that. You're better off taking the vaccine, because what I have to offer in the ICU, I guarantee you, is not 95% effective. It's not, nowhere
Wow.
near it.
Wow.
So the urgency to get back to your point is to prevent severe disease, to prevent transmission, to prevent more and more variants that come about that may be even more difficult than what we already have now to treat, especially when we don't have good treatment to begin with.
Great. That sort of does lead, though, into sort of what I wanted to ask about next. And so there are some people who maybe they don't have an issue with this particular vaccine, but sort of vaccines in general. They sort of think, my immune system is pretty strong. I'd really rather rely on that. You know, for those type of people who maybe just aren't really keen on the idea of a vaccine in general, sort of how would you respond to that? And I think some of it goes to what you were just talking about it being more effective in any treatment you have. But what would your response to that be?
Mm-hmm. So, you know, there are a lot of people that they always feel I'm healthy, right? I'm healthy. But one of the things that we know is there are a lot of people that still die with coronavirus that are healthy. That you know, and you say, well, what was their medical condition? And they say nothing, maybe a little overweight, but nothing, right? So there are a lot of people that can be healthy, but because of their body's response to this virus, their response to the virus can lead to them having a devastating outcome. The other thing is, even if you happen to, survive it, there is the chance that you could, affect other people, infect other people, and those individuals don't survive it. My husband has a very good friend. He was my husband's best friend. He was in our wedding. My husband was in his wedding. His wife worked at a church and got coronavirus, and she gave it to her husband. She survived. He did not. And so, you know, I think one of the things that I oftentimes will say to people is, even if you feel that you're invincible, and I guarantee you, you may not be as invincible as you may think, um, there are other people that getting vaccinated you will protect. And one of the devastations that we see in families, and Ramona mentioned this earlier, is where entire families have been wiped out from coronavirus. And it's a horrible sinking feeling to feel that I gave it to this person and that person, and they died and I survived. That's a horrible feeling. And we've seen it. I've taken care of families where both parents died and a sibling died, all three in a week. It's devastating. And so, it makes you wonder, could things have been different if people had gotten vaccinated?
Yeah. And I think, the other thing is to really, to consider how, vaccines work, in comparison to if you got the actual disease or infection, like Dr. Williams is discussing. So, in both circumstances, your immune system is going to, respond to whatever, either to the vaccine or to the actual virus itself. But there's a difference, you know?
Mm-hmm.
So the difference is if you're exposed to the virus, then you're open to this like the consequences or like the domino effect that can occur when you are exposed to something, which could be as something as mild as you're sick for a few days all the way till you die. And but your immune system was engaged in that, of course. But on the other side of that, you have the vaccine, which also is going to cause your body to have an immune response. It requires an immune response no matter what. But if you get vaccinated, then you're not at risk for that very wide range of things that can happen, including how sick you may become, any kind of long-term effects, or the risk of dying or passing it on to someone else. So, I have a friend who's a firefighter, and as unfortunately a lot of firefighters, EMS, were exposed very early, and he got COVID. And, he said, he survived. He recently just got vaccinated, and people were asking him, well, what was your experience in getting vaccinated? Because that's usually what people are asking me now. It's like, well, what happened when you got vaccinated? But he said, hands down, here's a healthy young man who is a firefighter, so he's in pretty good shape, and he still said, this took me out for a long time, and I would choose to get vaccinated and take this vaccine every day over what I had. And this was someone who was not hospitalized, who didn't have the severe, complications from it. But I think people have underestimated how serious those things are. I mean, I've talked to people who would say, I'm a runner. I run 5 miles a day. I get winded. It's 8 months later. I'm getting winded walking up the steps. And so people don't understand, like, it's, when we talk about recovery rate, everybody is like a statistician at this point, and they explain to us like, well, the percent is really, they're like explaining. But, when we talk about someone recovering, we're talking about someone who didn't die. We're not talking about someone who's not having effects. We're not talking about the fact that you're at 100% of who you were before you got it.
Mm-hmm.
Because for a lot of people, that's not true. That's not the case.
I would also add to that, if we really take a step back and think about many of the diseases that have plagued our society, vaccination has been the way that we have gotten out of devastating disease. So you take something like polio, right? Polio would leave people on respirators and crippled. And we came up with a vaccine for polio, and people got it, and it revolutionized society. I'm an old broad, despite my youthful appearance. And I still have what was back then a smallpox vaccination. And so every now and then you'll see people of my generation and older that have this big ugly scar on your arm from the smallpox, right? So smallpox used to be the scourge of the planet. And then we came up with a vaccine, and smallpox was eradicated, right? And so when you think of things that historically have been scourges on the planet, like polio and smallpox, our way out of it was through vaccination.
Yeah, absolutely. And I think a lot of people don't understand because we're in such an age and a time where a lot of the things that we're vaccinated against, we've actually never seen,
Mm-hmm.
as far as diseases.
Right.
But,
Right.
the reason we don't see them is because people have been vaccinated.
Exactly.
But there are occasions where we have pockets of outbreaks that occur. And we have one. So if you are, had a baby, in the last probably 10 years or so, people, you're given a Tdap shot in the last trimester of your pregnancy. And that's to help protect the baby against whooping cough. But what we saw was that we were having babies with whooping cough. We've had outbreaks of measles, because part of what you hear, of course, is talking about herd immunity. Let's get to herd immunity. But the whole point of that is that you need a certain percentage of the population to be vaccinated to keep down the virus from spreading among the population. And when those percentages decline, then you can have these outbreaks among people who are not vaccinated. So you have to think about that everyone can't get vaccinated. Some not, there's different reasons. Right now we can't vaccinate anyone less than 16 years of age. So that's going to be a group of people who are unprotected. Depending on someone's medical condition, their doctor might say, right now, don't get vaccinated. That's a person who is unvaccinated and they are relying on the rest of the society around them. Even if, you don't realize it, the fact that you have been vaccinated helps keep that low in the community, and that protects those who can't be vaccinated and who are at maybe higher risk of having a more severe outcome. So when we see those, pockets where there's low vaccination among communities, we can see outbreaks there. And, that's one of the things that I'm highly concerned about with COVID, is that we may see some communities that are at higher rates of vaccination, and we may see other communities that are at lower rates, and that we will see more outbreaks in those communities that have lower vaccination rates. And, just like people, explain to us about the numbers is, a percentage of that are people who are going to go to the hospital. A percentage of that are people who are going to be in the ICU. A percentage of that is going to be people who die. So the numbers matter in that way, because the higher they are, those chunks of percentages are people who, and that's a higher number. So that's also part of this too, is like we want people to understand that we need to all kind of be in this together to get out of this, because our community will still have this virus circulating if we don't reach a high enough number.
I want to talk a little bit about sort of communities that may be at higher risk. So we know that we saw, and still continue to see through this pandemic, some communities are at higher risk, that not every community was impacted the same. Some have been disproportionately impacted by the serious consequences of COVID. And yet oftentimes, so often these are communities of color, maybe African Americans, and there's reason for that. There is good historical and present day context for that. But also along with that, for some of those same historical and present day context reasons, those same communities may have more vaccine hesitancy. So that's maybe where communities that are also most at risk and impacted, where we're seeing the most hesitancy around getting the vaccine. Can we talk a little bit about sort of what that context is, because it's real and it's legitimate, and we don't want to, sort of brush that aside, because it is valid and real. But then what risk then does that leave our communities at if we're not vaccinated?
Yeah, so it's a very, how would I say, complex dynamic, because the reality is that historically there have been things that our government has done that was not right. It was not right. It was abhorrent, unethical. It was immoral to let people suffer and die from syphilis when there was a cure for it. That was wrong. It was wrong. And we, since then, have put things in place to protect against that ever happening again in subsequent years. A lot of committees and rules and regulations, institutional review boards, those kinds of things were put in place because everyone recognized how horrific that was. And it wasn't that long ago. That experiment continued into the 1970s. So wasn't that long ago. And so it is very real and fresh in people's minds. But what is also very real is that in addition to policies and committees and review boards being put in place, we now have sitting in positions of leadership, sitting in positions of expertise, in positions of advocacy, people that look like me and Romona, that are saying, listen, here's the data about Black and brown populations. And the reality is that if you're African American, you're 2 to 2.5 times more likely to get severe disease, be hospitalized, and die. That's true. That's true. And we have looked at the data here and all across the country, and it's real. So much so that at the federal level, there's actually a physician um, who is charged with looking at the inequity that exists as we look at COVID. And the reasons behind a lot of the inequity, let's face it, has to do with the disproportionate amount of chronic disease that exists in the populations that we're talking about, largely African American and Hispanic communities. So we know that chronic disease is disproportionate in those communities. And then when you layer on top of that a pandemic, and on top of that historical mistrust, there's going to be a hesitancy and a disproportionate amount of uptake. You also layer on top of that the fact that there are inequities and disparate rates of things like access to the vaccine. So if you're somebody that has to rely on public transportation and there's not a bus route to where the vaccine is being offered, that's a challenge for you. And it makes it more difficult. If you're someone that is of an older generation where you did not grow up on being computer savvy, then it's a challenge for you to get online and register. My mother is 81 years old. I registered her. But not everybody has a daughter that's computer savvy that could register them, right? And not everybody has the internet. Not everybody has a laptop. And many of the resources, like the public library that people go to use computers, that hasn't been open, right? Because we've cut back on hours, we've cut back on so many things being open. So the truth is that there's a disproportionate amount of vaccine uptake, not only because of hesitance and distrust, but also access. And this is why it's important that people like me and Romona get out there and say, listen, we understand what happened. We know. But this is something that we have to be real and honest about. And the honest truth is we're dying at a greater rate. We're dying at a greater rate. And, I was saying earlier, as a critical care doctor, seeing so much death and devastation, even though I'm somebody who actually, enjoys sort of my private life and not being front and center in front of cameras with bad hair days and every single pimple showing on my face, I found myself saying, well, shall I just sit here in the ICU and keep delivering bad news to people? Shall I just sit here and keep telling people I'm sorry and handing them boxes of Kleenex? Or do I say, well, I'm a member of the Board of Health. I'm the chair of the diversity committee. Let me get out here and really, extend a hand to my own community and to others who may have hesitancy because of distrust of the government or distrust of our politicians or even healthcare systems. I have patients that say, I don't trust the doctor, you know? That's a very real and complex issue. And what I always encourage people to do is really, if you trust your healthcare provider, and hopefully you do, be it a pharmacist, nurse practitioner, doctor, talk to your healthcare provider. If you trust your pastor, talk to your pastor. Um, try to really get reputable sources, people who are well informed. I know there's a lot of information on the internet, and a lot of it is incorrect information too.
Yeah. And I think, what I try and tell people is, you know, both things can be true. Is that your experience, are the historical experience as well as current day experience
Hmm.
can be true, accurate, reflective of what has happened, and you still need to be vaccinated. Like,
Hmm.
so it's not necessarily the reason you shouldn't get vaccinated. I think, to understand it's both.
Hmm.
And, you know, one of the things that we've been very intentional about is access. And, you know, and very intentional. Like, where
Hmm.
do we go? Who do we work with? So we will work with community organizations to make sure that there's access for people who don't have internet, or we work with, those organizations or cities or senior centers if people don't have transportation. And so there's a lot of work going on to try and make sure that it's accessible, but it's definitely an issue. But I guess I just wanted to make sure that I express that it's something that we're also committed to making sure it happens. That's what I spend most of my days doing at this point,
Hmm.
is
Hmm.
how do we make sure that the vaccine is in communities and accessible to people who may have difficulty accessing the
Hmm.
vaccine. And so, just looking at those disproportionate numbers, and like Dr. Williams said, of if there are conditions that are already there, like high blood pressure, obesity, things that do put people at more severe risk of severe outcomes, that we want to specifically target those areas, because it will save potentially severe disease, hospitalizations, and then we talk about all those other things that we talked about. The devastation that happens to communities when there's this widespread of the disease in their community. So yeah, I think it's both the historical perspective and actual lived experience is valid,
Hmm.
and
Very.
we still need to be vaccinated against COVID.
Right.
Right,
Yeah.
right. So we have a few questions that people have submitted. Want to make sure we get to those if we can. So one, and this is, I think, one we probably hear often is, what about the long-term effects? It's scary not knowing what can happen to you in the future if you take this vaccine. So
Hmm.
how would you respond to people who are worried about, this is a new vaccine? How do we know what's going to be the long-term effect of it?
So, and this is a very valid concern. I'm putting something in my body and it's new. And one of the things that I always say to people is, although this vaccine is new, the technology that the vaccine is built upon is not new. And the technology is a technology that has been used in other vaccines and products, like, for instance, mRNA, which Pfizer and Moderna are mRNA vaccines. That technology has been used in chemotherapy agents, right? And there have been people who've been getting chemotherapy for their cancer or malignancy for some time. And so, although this technology has a new application, it is not a new technology. It's actually a technology that's been around for decades. And people, in part because, it was all over the news and the internet. We've done this at warp speed. We're getting it out there quick. People assume that because it was done so quickly, they must have cut corners and, it's not going to be safe. And the truth is they didn't cut corners when it came to being sure that it was effective and being sure that it was safe, because it went through the same phases of trials and the same scrutiny and approval by committee that vaccines normally go through. What was shortened was a lot of the bureaucracy and red tape. The other thing to keep in mind is when you do a trial, you have to recruit people to be in the trial or the study. We didn't have to recruit people as vigorously during the middle of a pandemic, right? So we were able to enroll people very quickly. We were able to study the effects in real time in society because there's so many people who have the disease and that are affected, and it's spreading so quickly. So a lot of the things like recruitment, the bureaucracy, red tape, even the finance of developing vaccines, those kinds of things were eliminated, right? And so that allowed them to move along with getting the vaccine up and running in a shorter time period. One of the things I say to people is, in anything that you do, there is risk versus benefit. And there's no such thing as 100% sure that such and such is the case. There's no such thing. And so if you say to me, is it possible? Well, there are plenty of things. Everything in the world is possible, right? The question is how probable or likely is something? How probable is it that we'll see some long-term side effect, or how likely is it? And the answer is not very likely and not highly probable, because we haven't seen it thus far. And usually these things are things that are seen early on. We haven't seen it when this technology has been used in other applications. And so the likelihood or the probability is very small, very small. Can I say completely non-existent? No. I can't say that with a straight face. What I can say, though, is for sure, what is definitely known is that coronavirus has long-lasting effects. That's known, and that exists right now, here today, and is devastating people's lives. What I can say for sure today, right now, is we don't have any type of therapy that's anywhere near as effective at treating you if you get severe disease as compared to the prevention of severe disease. And so when you look at the risk versus benefit of something that maybe, possibly could happen, that we've seen no evidence of in all this time, versus what we know exists in reality with certainty today, then the risk versus benefit is there for getting the vaccine.
Mm-hmm.
Great. Another question. This is, I think, kind of more logistical, but also a little medical. Is it okay if I go alone to get my vaccine, or should someone go with me?
Yeah, most people are going to be okay alone. You might want some emotional support. I get it, but most folks are okay. We give the shot, and a lot of the places work the same. Whether it's the health department, it's the Wolstein Center, it's one of the healthcare providers in the community, or a pharmacy. You get the shot, and they assess. They'll ask you some very standard questions just to see, should you get the shot today. And then you get the shot, and then you wait for 15 minutes for most people. Some people need to wait a half hour if they've had a reaction to something, and somebody at that point will let them know that. And then they're good to go. I mean, we see, we've done, I don't know, we've done maybe 26,000 vaccinations at this point altogether for first and second doses. And the amount of reactions to it is almost nothing. I mean, most of the time it's like, oh, I feel a little flushed, or I had someone tell me this weekend, they're like, oh, my arm hurts. And I'm like, yeah, you just got a shot. But, yeah, but I looked at it, of course. But it's just those types of things. So it's not one where like, if you got your eyes dilated and you can't see when you walk, when you walk out because the sun is too bright. It's if you normally would do okay with a shot, then this is the same. I mean, I would compare this more to getting a tetanus shot than a flu shot. So if for folks who've had it before, it does cause a lot of people, the most common side effect is a sore arm. And usually that lasts for a day or two, and then that's about it. And other people can have other symptoms, like, because we talked about whether you're going to get sick or you're getting the vaccine, that you're engaging your immune system. So your immune system is kicking into action and saying, oh my God, what is this? Let's get it out of here. So you can start that feeling of getting sick, which could be a temperature or chills, feeling tired. That also seems to be a very common side effect. And those are also short lived. So about a day or two after the shot, most of that resolves for most people.
Great. Another question, what would you say to someone who's trying to get an appointment, but they are not having any luck?
Yeah, keep going. Vaccine supply is opening up. I think the Wolstein Center is a great opportunity. Deanna and I talk every night about the Wolstein Center, right, Deanna? Yeah. And there are thousands of appointments available every day. I mean, we are really lucky to have this in our community.
Yes.
Because not all communities have this opportunity, and to help get so much of our population vaccinated in a short period of time. I mean, this is really unique, so we have this here now. The appointments open up every they'll open up a couple of days at a time. So you have to just keep checking the website to fill it in. Now that website is also up and running, you can look at what is around you that also has the vaccine, and then get a link directly to either their website or to make an appointment from the website. Mm-hmm. So don't give up. Like I said, it is really opening up. And also, take whatever vaccine is available. That's the other thing. I think Dr. Williams said it, about Moderna or Pfizer. A lot of people ask us that question. Well, what are you, which one is it going to be? And, sometimes I can tell them, but sometimes I can't, because it depends on what we have. But no matter if it's Moderna, if it's Pfizer, if it's Johnson & Johnson, they are all very good vaccines. And the point that Dr. Williams made of, the ultimate outcome of preventing severe illness and death, the effectiveness of those is high among all of the vaccines. So, if it is presented to you, take that chance. Don't say, oh, I'm only going to take Pfizer. And I've had people tell me, and I don't know how they choose, but, I've had it both ways, where they prefer Moderna, and I've also had, they prefer Pfizer. Mm-hmm. But if you have that opportunity, whatever brand of vaccine it is, because a lot of times people don't understand there are different brands of flu vaccine, but you just have no idea of that because you just go get a flu shot. So, whatever it is, take it.
Right. And I will just throw in an extra plug for people who are having trouble getting an appointment. And I know Dr. Williams talked earlier about, people who don't have computer access. You can't get to the library, you're not tech savvy. United Way of Greater Cleveland 211, they have been fantastic. They have a bank of operators that do nothing but book vaccination appointments for people. So pick up the phone, dial 211. They'll find a vaccination site that's close to you, an appointment that is as soon as possible, including at the Wolstein Center. So if you go on the website and it doesn't look like there's any appointments available at the CSU Wolstein Center, call 211. They have ways of getting you in. And they can also connect you to transportation. So it's on a main bus line. They can get you transportation, whether it's ride share or a bus pass. So if you're having trouble on your own, call 211. They will help you get access. We're coming close to 2 o'clock, and I know you all probably need to get back to work. We've covered a lot of ground. Is there anything else that you think is one of the questions you get most often that you want to make sure that you answer for people, or just sort of one last thing that you want to make sure people can take away with?
I think for me, one of the questions I get the most is just, have you been vaccinated? And what was your experience? And the answer is yes, I have been. I was vaccinated back in December, and I have to be honest, I felt a little guilty about it at the time because, I know that there are people who are out there who this was going to be difficult to get because especially then vaccine supply was so low. But I also felt like I have to be willing to do what I'm asking other people to do. And so one of the things I actually heard Dr. Williams say, she doesn't even know this. I don't know if I told her this or not, but she was the first person vaccinated at Metro. And when she was in an interview, and one of the things that she said is, when I think about this, and I'm paraphrasing, of course, and I might hesitate for a minute. I just think of the patients that I lost. And you can be have kind of in your mind, I'm not really sure, but when you really think about the impact it has had to your family, to you, to your family, to your community, to our society, am I going to let this ounce of doubt stop me from doing all of this that could help get us out of it? And that is actually part of what encouraged me just to go ahead and do it. And then also to work as hard as I can to make sure that it's available in the community. So, I just want to encourage people that, you don't have to feel 100% to continue to do it. You do need to weigh the benefits and the risks and see that the benefit far outweighs.
Mm-hmm. And I would echo what Romona has said. On the morning that I was getting the vaccine, I called my 80-year-old mother and said, I want you to pray for me. I'm getting this vaccine and I'm nervous. I'm nervous, and I'd be lying if I said that I wasn't nervous. I was nervous. I'm thinking to myself, what if I get this vaccine and pass out in front of all these cameras? What if I get this vaccine and immediately, I have some weird reaction? I mean, I imagined all of these things. And the truth is, none of that happened. And the truth is being brave is not about the absence of fear. Being brave is not about the absence of fear. Being brave is feel the fear and do what you're called to do because you're called to do it. And I do believe that we're all called to do things in our lives, sometimes for ourselves, sometimes for other people, sometimes for society and people that we don't even know, right? And people oftentimes say, oh, well, Dr. Williams, you're a critical care doctor. The doctors, nurses, they're our heroes. No, I'm asking all of you out there to be a hero and to perhaps feel the fear, but go ahead and do it anyway and get vaccinated. Be a hero to somebody you don't even know. Be a hero for your community. If you live in a Black and brown community, we need some heroes because we have an uphill battle. Be a hero for the kids that need to get back to school. Be a hero for elderly people. Be a hero for the rest of society, not just in our community of Cuyahoga County, but the rest of society that on an economic scale needs to get back into some semblance of normal from an economy standpoint, right? And so there's so many reasons to sort of feel the fear and do what you hopefully will feel called upon to do as a hero for so many other reasons.
Could not have said it better. Thank you so much to both of you for joining us this afternoon.
Thank you so much for having me. It's really been a pleasure to spend time. And certainly, if there are any other questions or if people, feel like we just need another moment of reassurance, I'm there. I'm there.
Absolutely. Thank you so much to both of you, to Dr. Williams and to Ramona. And just for folks who still have questions, you need to know more information, resources, we're on the HHS Facebook page right now. We will continue to post information, resources, some videos with Dr. Williams and some fact sheets, all to help you get more information as you need it and decide whether to get the shot. All right. Thank you so much for your time this afternoon.
Thank
Bye-bye.
Thank you.
Everyone have a good
Bye-bye.
one.
Thanks for having us.